Hi everybody, so our presentation is going to be on ischemic strokes, and this is presented by Miranda, Jessica, and Severo. The presented patient is Mrs. Kim, who is a 71-year-old female. She was brought into the ER by her daughter, who was visiting her house for lunch and had noticed that she seemed confused. Mrs. Kim has no history of confusion. She lives alone, and her daughter suspects that she is not properly following her medication regimen. Her previous medical history includes borderline diabetes and hypertension. The patient also reports being a smoker of 53 years. The patient's primary language is Korean and can only speak broken English. Per her daughter, the patient reports having hiccups for the past day, but does not remember when she began feeling dizzy or ill. Her daughter brought her into the ER immediately. Upon assessment by the nurse, the patient complains of pain in her left arm and left leg, as well as left-sided weakness. The patient is unable to maintain their balance and requires assistance getting in and out of bed. A focused neuro assessment revealed the patient to have left-sided facial weakness and nystagmus. Current vital signs are as follows: BP 142/90, heart rate 88 beats per minute, respirations 18 per minute, and temperature 95.8 degrees Fahrenheit. Based off the initial assessment of symptoms, the physician believes the patient has suffered a stroke. To confirm this suspicion, the patient should receive a stat head CT. Additionally, the bedside nurse should try to look for ways to promote safety, such as implementing fall risk precautions. The bedside nurse should also obtain a Korean interpreter, as it is not suitable to use the patient's daughter to interpret information. Because Mrs. Kim is of Korean descent, there are certain cultural considerations the nurse should be aware of in order to improve the quality of care delivered. Asian Americans are one of the fastest growing ethnic groups, with an estimated 12 million living in the United States. Despite this rapid growth, they remain one of the most understudied groups, with relatively few studies of their health status and service use compared to other minority groups. Asian Americans are culturally and economically diverse, coming from 30 distinct ethnic groups, each with their own traditions, cultures, and languages.
So we're going to continue talking about cultural considerations for Mrs. Kim. Again, we're talking about her Korean culture. So when you greet someone who has Korean background, it's important to be respectful and have good manners. So when you go to shake hands, for instance, I know right now with COVID, it's probably not happening anyway, but you would include a slight bow, and especially consider that for older Korean Americans, they might not even be accustomed to shaking hands. So the best thing the nurse can do is just ask, is it okay if I shake your hand? Again, when we're dealing with cultural competency, we just want to ask. I mean, it's better to ask than to offend, and just do it in a respectful manner. So during a medical interview with an elderly Korean patient, it's important to not forget that formality and respectfulness is expected. So we want to not be arrogant. We want to respect that patient and remember to convey to them that, this is a formal interview and that their views are being taken into consideration. So appearance is also very important, again, going back with that formality. So sitting up straight, avoid putting your hands in your pockets. When standing, that can be interpreted as something that's rude and disrespectful. So you just want to present yourself as standing up straight, proper, again, not joking. We're, conveying information in a respectful way. Also, extended direct eye contact can be considered rude. So again, if you're not sure about what this patient is used to or wants, you can always ask either the family members or the patient. It's important to remember, not just with the Korean culture, but any culture, that hospitalization is taking this person out of their comfort zone, out of what they're used to. So it can be undesirable for especially an elderly Korean patient, because they're being separated from their family. Family is very important to the Korean culture, and they're a very family-oriented culture. So they might have a preference for traditional medicine. They might not have foods that they're accustomed to eating. As you can see from this picture, there's some Korean food, and we all know that is not what they're serving at the local hospitals. So again, just asking, because we don't want this patient to go without eating, especially if they have nutritional deficiencies. We want them to eat. So maybe there's a middle ground where we can find something that still fits into what they're used to, is healthy, and is going to promote health. So if you see a tray sitting there untouched, rather than just proceeding on, maybe find out, is it because they don't know what some of that food is, or they're not used to it, or they don't know what it is. So, yeah, that's something that definitely should be taken into consideration with your plan of care. Also, for Korean culture, like I said, they're very family oriented. So we want to keep that family in close communication so that we can respect the patient's needs. Korean culture does consult with the family before making big medical decisions or big decisions in general. So I know with COVID, they don't have visitation right now, but there has to be a way that you can try and incorporate them, whether it be, having a phone conversation in the room with the patient so they know that you're taking their family into consideration and their views as well. And of course, with that comes consent, right? We want to make sure we have consent for the family members that the patient does want to have involved in their medical treatment so that we can involve them. So, very important to get that consent and know who they consider to be a big decision maker in their treatment. So moving on with cultural considerations, it's very important when there's a language barrier that we make sure everything is being communicated correctly, because we don't want any misinterpretations. We don't want the patient to feel uncomfortable because they don't understand what's being done to them, or if there's procedures that they need to have done, we need to make sure that they understand. So for most Korean elders, they do use Korean as their primary language. The nurse needs to be aware that some elders also may not be literate with reading or writing. If they come from a limited educational background, we need to make sure that we're not just handing over something to sign. Again, like we said, one of our recommendations is having an interpreter. We can't solely rely on a family member because, again, we don't know what they're saying if we don't speak Korean. So we need to know that the patient is fully aware of what is happening to them, especially for informed consents, especially for medications and procedures. They need to feel comfortable, and we need to know that they know what's happening. So education is very highly regarded in Korean culture. So if they don't understand something, they may be hesitant to admit that they do have difficulty with reading or writing. They may be embarrassed to admit that they don't understand English. So we need to establish that comfort and trust with the patient so that they feel comfortable being forthright with us and letting us know that they don't understand. Again, like I said, they do involve family members in their decision making. So usually the important decisions commonly involve conferencing and relying on their eldest child, usually the son, but it can also be the daughter if there's not a son involved. So again, all of these things have to be taken into consideration when we're planning our care as the nurse. So along with cultural considerations, we also have to take in the spirituality of our patient. So Mrs. Kim is Korean, again, as we said, which is heavily influenced primarily by Buddhism and the philosophy of Confucianism. There is also Christianity. It wasn't stated what her primary religion was, but for the most part, Buddhism and Confucianism are part of the Korean culture. So we're just going to focus on that. Modesty is very important. So, for this patient, we want to provide privacy. We want to make sure they're comfortable. We don't want to push them or rush them, or make them feel uncomfortable in any way, because they are very modest. I mean, especially when it comes to, being naked in front of strangers. So we just want to make them, again, feel very comfortable and secure. Let them know, hey, I'm here as your nurse, and, we're doing this so that we can make you feel better. And, that means drawing the curtains, making sure that they're covered as much as they can. If they can, you can step out of the room. In this case, she is a fall risk, so we would want to stay in there, but maybe we can turn away while she changes, just to give her that comfort of knowing that we're respecting her modesty. Also, they may be hesitant to talk about intimate details such as bodily functions, sexual history, things in that regard. So again, establishing that trust is so important, and just communicating to them the importance and why we're asking that information, and that it's respected information, it's private, and we respect and honor that they're telling us that so that we can help them. So along with the cultural considerations, we're also going to take into consideration the patient's age. She is 71, so she does fall into the older patient category. So we want to treat her just like we would any other elderly patient, and that means that we're taking into consideration the aging process. So she might not be able to hear as well or see as well. Again, this patient is dizzy and does have confusion. So we want to make sure that they're getting the information clearly. So we're going to speak clearly. We're going to speak simply. We're going to do that while we're conducting our assessment, while we're teaching. We don't want to shout at the patient, but we want to speak to them in a way that they understand what we're saying. So we want to use therapeutic communication. Again, this patient is confused. She speaks English as a second language. She comes from a different culture. So we want to just be therapeutic with this patient. We want to make them feel as comfortable as possible so that we get the most information and can treat them the best. We also want to take into consideration their risk for falls. So when we're designing that plan of care, because she is dizzy and also her age, we want to make sure that the hospital room is safe for her. So we don't want anything laying on the floor. We want to make sure those side rails are up, bed is down. We want to make sure everything's within easy reach for her. Let her know if she does need to get up for any reason to, use that call light that's within reach, and always ask for help. And we can always, pre-COVID, have family present during the assessment. So because of the age and her cultural background, this patient would probably feel comfortable having her older daughter there. But again, you want to ask to make sure if that's what she would like.
Pathophysiology. A stroke or a cerebrovascular accident, CVA, can be formulated in three categories based on initial cause: ischemic, hemorrhagic, or subarachnoid strokes. In reference to the patient, ischemic stroke is a further compromised into two potential causes by either a thrombus or embolus substance that impairs circulation of the blood flow to the brain. Ischemic thrombus stroke impairs blood flow due to a dysfunction within the vessel itself, usually caused by inflammation, atherosclerosis, or arterial dissection. Ischemic embolus stroke is a blood flow impairment usually caused by a debris mass such as coagulation, blood clots, fatty deposits, and air bubbles becoming lodged within the vessels. Initial damages and long-term debilitations post-stroke are depending on the specific portion of the brain that is affected. So again, in summary, an ischemic stroke is characterized by the sudden loss of blood circulation to an area of the brain, resulting in a corresponding loss of neurologic function. Acute ischemic strokes are caused by a thrombotic or embolic occlusion of the cerebral artery and are more common than hemorrhagic strokes. So signs and symptoms. Variants of signs and symptoms of a stroke exist based on the portion of brain being affected. The middle cerebral artery infarction, MCA, is the most common artery involved with a stroke. Display of hemiparesis, facial paralysis, and sensory loss is common. Dysarthria and aphasia can also be exhibited with the MCA. In the case of an anterior cerebral artery infarction, or ACA, symptoms can vary from motor deficits, specifically in the bilateral lower extremities, to aphasia and confusion. A posterior cerebral artery infarction, or PCA, consists of symptoms such as cognitive deficits, hypersomnolence or excessive sleepiness, numbness, ataxia, and ocular imparities. Other signs and symptoms such as prolonged headaches, ataxia, ocular motor dysfunctions, and sensory motor impairments can be indications of a CVA. Significant importance of an early diagnosis and treatment is stressed. Patient mortality life expectancy is greatly increased, and possibility of post-stroke side effects is reduced. In reference to the patient, their daughter had brought them to the hospital immediately after noticing potential signs and symptoms. This quick thinking action can reduce potential side effects and increase positive outcomes. So when you're teaching your patient about medications after discharge, typically for a CVA, they're going to be discharged with antiplatelet medications. For these kind of medications, you want to teach the patient to observe their body for any signs and symptoms of bleeding or bruising, and to report to their primary physician if they see any of these symptoms. Other medications possibly prescribed would be antihypertensive, since in this case this patient was hypertensive, to control their blood pressure and promote heart health. You want to teach them to check their blood pressure regularly, and you want to educate them on signs and symptoms of an ischemic stroke. They could possibly be discharged with anticoagulants, and again you want to teach them about signs and symptoms of bleeding and bruising, and you also want, depending on the medication like warfarin and Coumadin, you want to teach them that they're going to have to get regular checkups for their labs, such as a PT and our results. So when discharging the patient, we want to teach them about home care and healthy lifestyles that they can do on their own. So in an effort to reduce risk factors for the patient, a culturally sensitive dietary recommendation and information is provided. In the scenario, the patient is of Korean descent. Korean cuisine typically incorporates salts such as soy sauce, fats and oils, and meats, rice rich with carbohydrates, and sauces high in sugar. Long-term eating habits with foods incorporating these ingredients are risk factors for the patient to develop cardiac problems such as hypertension and diabetes. In this case, dietary recommendations would be to eat these cuisines in moderation, with emphasis on reduction of salt, fat, and sugar intake on a daily basis. The patient would require following a carb control modified cardiac diet, such as a no added salt and carbohydrate control diet, or no added salt carbohydrate control. Importance of adherence to dietary recommendations should be stressed. Referral to a registered dietitian is appropriate also. Along with a healthy dietary well-balanced diet would be for the patient to stay as active as possible. Inactivity can decrease recovery rate. Physical and occupational therapy could be recommended. For them to stop smoking would be greatly recommended because smoking is a huge risk factor for strokes. We would also want to keep walkways clear of clutter, non-slip rugs, and keep items within reach. And we would consider installing assistive bars near the toilet and shower due to the patient's advanced age. These are our references. Thank you very much for taking the time to watch our presentation, and we hope you have a good day.